before we do get started, I would just like to say I hope all of you and your families are staying safe and healthy during this time. I know our community is definitely being affected, as many other communities are, by COVID-19. And I just want to share our deepest, sincere hope that you and your families are staying safe and healthy during this time. All right. So a brief overview about ElderHelp and why we are doing this webinar. So ElderHelp has been around for quite some time. We're celebrating over 46 years of supporting seniors here in San Diego with a variety of their services and needs through a variety of programs that we offer. We also assist family caregivers through support as well. This just gives a list of the different services that we do have. I did want to highlight right now, we are offering information and referral services for people who are looking for resources or trying to find out what is available for their loved ones during this time, as well as direct services for seniors. So our family caregiver support is something that we offer through these webinars on an almost monthly basis, covering a variety of topics. We also have our online courses that I encourage any of you to check out if you're interested or know somebody that might benefit from having different assessment tools or education for them throughout their journey of being a family caregiver. And now I'm excited because we are recently started more of a partnership with Alzheimer's San Diego, and we have a great presenter for today's topic of long distance caregiving. So we're excited to be able to partner today. So before I give the reins over to Amy as our presenter, I'd just like to share a few words about her and her experience. So Amy has worked in the field of long-term care in San Diego for 20 years in care management, dementia care, and community health education. She holds a joint Master of Social Work and Master of Public Health from San Diego State University and is a certified positive approach to care dementia trainer. Amy is a longtime member of the Aging Life Care Association and serves on the board of directors for the National Academy of Certified Care Managers. She is a passionate educator and vocal advocate for aging and disabled adults, and currently serves as the Director of Education for Alzheimer's San Diego, a local nonprofit organization whose mission is helping families today while finding a cure for tomorrow. So it's an honor and a privilege to introduce you to Amy Abrams, and I am going to allow her to take it from here.
Great. Again, I'm Amy, and my deepest gratitude to Carrie and to ElderHelp for partnering with us on bringing this program to you. So this class is called Long Distance Caregiving, and as you heard, I'm with Alzheimer's San Diego. So it is a course that is specific to people who are caring for somebody who's living with dementia. But a lot of what I'll be talking about actually applies to caregivers of all types who care for someone from a distance. So a quick look at our agenda before we get going here. I'm going to be talking about the challenges of caring for someone with dementia from a distance, ways that we can provide support to people who are local, ways to find resources and support when you need to find out about information, resources, service providers in another town or sometimes even in another country. We'll talk about the all-important technology solutions that are out there and available for long-distance caregivers, and I am going to share quite a few resources with you, and we'll talk about just briefly tips for planning visits. So, let's see, not advancing. There we go. Okay, so let me just start by saying what I'm really talking about here. When I talk about a caregiver. Who exactly is a caregiver? This is language that we actually at Alzheimer's San Diego, we tend to use the term care partner more often because there's sort of a power dynamic that exists between the recipient of care and the giver of care. But when you're long distance from somebody, those dynamics change, right? Also, what exactly is a long distance, right? The term long distance caregiver has actually changed meaning dramatically just in these last several weeks. And now even those of us who care for someone with dementia who is local, they may be right down the street, we may now identify as long distance caregivers because of physical distancing or quarantining requirements, either at home or within a residential care setting. So if you're on this call right now, I would just say yes. However great or short the distance, I'm speaking broadly today about the ways that we can care for and about someone who's living with dementia from a distance, whatever that distance may be. Okay, so a quick look at the most significant challenges of caring for someone from a distance. It can be very hard to know that we've got the full picture, right? What the person is presenting to us is often limited. Are we getting complete information? Are we getting reliable and timely information? We may be uncertain. We may feel concerned that I feel like I need to step in. I'm worrying about my loved one's nutrition or personal hygiene, for example, but not really being certain because we have to maintain that distance about when it's appropriate to intervene. There's also the practical reality that sometimes we don't actually have the authority that we need to intervene. Do we, in fact, have durable power of attorney documents in place? And do we have the authority? Do we have HIPAA waivers, all of those things that we need, permissions from care facilities to step in and intervene when we need to? Of course, if our loved one is in another location and we don't live there, have never lived there, we may be unfamiliar with the good local resources, the reliable professionals, for example, that you can count on for information or support. And then, of course, there's just the practical logistics that make caring for someone from a distance a challenge. If you live in a different time zone, if you have to get in the car or hop on a plane every time you're going to make a visit, that's a lot of time, and of course, it's a lot of expense. Okay. It can be a challenge to manage multiple responsibilities. We're all feeling that right now, managing the day-to-day of our own life while struggling to keep up with the responsibilities of another person's life. There's communication challenges. Again, one of those things we're all feeling deeply. I'll talk about this in a little bit more detail here in a moment. There's a lot of emotional challenges as well. No matter how much we're doing, no matter how good of a job we're doing at it, we are likely to feel some form of guilt. I'm not doing enough. I'm not doing it well enough. I'm not doing it in a loving and patient enough way. Guilt is a very common emotion for the long distance caregiver. And there's a lot of, there's a huge challenge just in coping with new family roles, new relationships and responsibilities that we have to this person that we probably did not have before they developed physical or cognitive impairment. And then, of course, family conflict. It's common in close families, geographically close families, as well as families who are spread across great distances. Making decisions, coming to an agreement about care strategies is a source of significant conflict in a lot of families. So here, those communication challenges of which I spoke. Speaking by phone or using video conferencing, which most of us are doing with more frequency these days, it's not perfect, right? Certainly the person with dementia is living with the memory loss and confusion that is characteristic of Alzheimer's or whatever form of dementia the person may have. The person may have no limited or no insight into the fact that anything is actually wrong with them. It's very common that a person who's living with dementia does not remember what they don't remember, and they're not sure why everybody is so concerned, or I'm not sure why I have this caregiver coming here every day, or why I'm living in this place. Confabulation. This is a fancy word that we use for when the brain just makes stuff up. And this is something that all of our brains do, where your brain is sort of filling in the gaps in information, in stories. This is actually a very important cognitive function. We all do it, but in individuals with dementia, the challenge is their brains have a lot more gaps to fill in. They do more confabulating than the rest of us, and often they don't know the difference, nor can we tell the difference, right? When a person is, for example, missing some objects, that could mean that they've misplaced them. It could mean that they hid them. It could be that that object is sitting in plain sight, right? But the story that you're getting is that, well, there's this person that comes around and takes all of my things. Right? That's not necessarily a person lying or making up a story. That's what their brain is telling them. That's their brain's explanation for where those objects are going. This is really challenging always, but especially when we're long distance and we can't just pop in and have a look and see if we can find that missing object. Difficulty using technology, right? Like me and Carrie this morning here. It can be exceptionally difficult for all of us to use this fancy new technology for staying in touch with each other. And then compound that with cognitive problems, problem-solving abilities, difficulty with sequencing, difficulty with perceptive abilities, and then layer on things like hearing loss or vision impairment. It can be very difficult for a person with dementia to use a fancy new technology that you've invested a lot of time and money in getting in place to facilitate your communication. And then there's just this sort of broad challenge of a lack of context when we can't see each other and really feel what the environment around that person is like. What does their house not just look like, but how's it smell, right? How does it feel in here? Are we getting the windows and the curtains open for a little bit of sunlight every day, right? A person can tell you that they're doing just fine, but we really lack a lot of big picture context when we aren't face to face with someone. As long distance caregivers, we need a lot of information. We need to know medically how this person is doing. We need to keep up with appointments. Sometimes we're actually responsible for those appointments. We want to know if this is a person who lives in a private home, what's going on day to day, who's coming to visit, what is the schedule of visitors or friends or neighbors or social activities or caregivers, if there's professional caregivers coming in and out. It can be really difficult to keep up with a person's financial information, especially if you're lacking in that formal authority that I was talking about. And day to day, just sort of in addition to making sure a person is eating enough and getting to their doctor's appointments and what's the status of a medical condition. We just want to sort of know how's daily life and generally how is this person's well-being. So a couple of, just a brief overview of a couple of things that will help facilitate better access to information. I am going to keep this brief, but there are plenty of resources available through both Alzheimer's San Diego and ElderHelp if you need more information on these subjects. But those all-important advanced healthcare directives, those documents that name a person to be our agent for power of attorney for healthcare, and give them very clear, specific instructions about what we want and what we don't want. It is very important right now in the age of COVID-19 that we have advanced healthcare directives in place for ourselves, and certainly that we have copies of these directives, that we've got copies of powers of attorney documents. For example, if we are the designated agent for power of attorney, the designated healthcare decision maker for another person. So if you don't currently have those documents in place, or you don't have your hands on some copies of them, I would recommend getting that taken care of as quickly as possible. And yes, even in the age of physical distancing right now, there are options for getting advanced healthcare directives and powers of attorney documents drafted and signed. Conservatorship, this is in California. This is our word for guardianship. This is not always essential, but depending upon where the person lives, how limited their decision-making capacity is, how impaired they are, and whether or not they designated somebody to be their power of attorney before they lost capacity. A conservatorship is a legal proceeding wherein another person would be designated to be a full decision maker for another person who lacks decision-making authority. I mentioned HIPAA waivers before. These are release forms that give medical providers or long-term care or residential care facilities permission to speak with you, to get information about a person's health status or other kind of day-to-day status as needed. And then in addition to all of the specific legal documents that are named here, sometimes banks have other specific requirements. There are actually times that even being a designated power of attorney for financial matters doesn't work, and the bank has its own form that needs to be signed. So talk with the individual's bank and find out what permission is needed and how to get those documents in place. If these are not communication or information challenges for you now, terrific, but I strongly encourage you to get the access to this information in place now. Get your hands on these documents now before you need them. So what can we do to support local caregivers? If the primary care partner is somebody who lives nearby and you are the long distance caregiver, talk with them. Don't assume that you know what they need. Their day-to-day may be very different from what you are imagining. So ask them, what can I do to be most helpful to you? Sorry about my words here. The second bullet point is a little hidden, but what it says there is to really reflect on what you're good at, reflect on your own strengths and limitations. If you're not great with paying the bills and managing the finances, maybe don't step up and offer to help with that specific task, but find the things that you are good at. Maybe you're really good at researching and gathering information. Consider how you might be able to change your schedule to give that primary caregiver a break, whether that means coming into town for a short time to give them a break for a spell, or perhaps you could arrange for respite services locally that could come in and give that person a break. Do what you can, and you're doing some of this today by attending this webinar, but learn whatever you can about Alzheimer's disease, other types of dementia, or whatever the person's condition or conditions may be, so that you better understand the day-to-day of of what the person needs and how you can support that care partner better. And then, of course, from a distance, it can be challenging, but very important to identify those local resources. Who are we talking about when we talk about identifying local resource needs? I've come up with a list here based on my professional and personal experiences as a long distance caregiver and as a professional care manager in the past. Some of the things that I see that families need: help with household management, shopping and errands, especially need a large significant need right now, transportation resources, access to fun things, social activities, and sources of emotional support, both for the person with the disability as well as their care partners. Home safety assessment, again, because of that, you're not there, you're lacking that context, it can be very difficult to know how safely does he or she really navigate those steps in and out of the garage, for example. There are professionals that can come in and help you with home safety assessments. The management of medication is a significant challenge for anyone really who's taking more than one or two medications, but especially a person who's living with memory loss. Medication management may be one of the most important sort of in-person supports that we need to get in place early on when a person is living with dementia. The day-to-day, who's going through the mail and getting the bills paid and doing that day-to-day financial management. I talked about legal assistance. Well, who's good in town? So too with finding professional in-home care or locating an adult day program. Is there a day program specific for people who are living with memory loss nearby, for example? Residential care options. My goodness, depending on where the person lives, there may be dozens, there may be hundreds of assisted living and memory care apartment options. How do you identify from a distance what's a good one? And then once you have found what's a good one, how are we going to get them in there? So the packing and moving resources. This is just sort of what I think you need to know. There may be other resources that you need or you've looked for from a distance, but rest assured, these resources are out there, and there are ways of identifying good resources in another location. There we go. Okay, so what can you do to identify good sources of local support in another region? Talk to that person's local support system. So if they've got friends, if they've got neighbors, if they live in a residential care facility, for example, talk to the other family members of other residents who live there if you can. Right? If there's any type of an online communication or support group, get in touch with them and talk with them about who they use, right? Who's a good elder law attorney in town, or who's the best provider of non-medical in-home care. Talk to people that live in that area, and preferably people who know your person. Certainly, if they've already got a professional advisor in place, talk with them. They're longtime CPAs, attorneys, whoever that might be. They've probably got some recommendations for you. If you don't know people locally, locate their area agency on aging. Every major metropolitan area in the United States has one. Every area is covered by one of them, and you can locate them through this website, eldercare.acl.gov. Certainly find organizations like Alzheimer's San Diego in that area. By the way, at the end of the program here, I'm going to be talking you through some specific websites and resources for doing this. Don't forget the other community resources that surround them: senior centers, libraries, those day programs, for example. And then, of course, use your online support. Social networks and simply doing online research can be really helpful too. Two kinds of professionals I want to introduce you to quickly. If you're not familiar with them, they can be really helpful for the long distance caregiver. An aging life care professional, these are often also referred to as care managers. You can find more information about them and locate a referral for one in an area that you're looking for at that website that you see on screen, aginglifecare.org. These are professionals who have advanced training in social work or nursing usually, but other professions as well, counseling, gerontology, for example. They become the ears, the eyes of the family or the responsible party, and they can really be a great partner to you in navigating the long-term care system, helping you kind of prioritize, strategize, and manage those daily responsibilities. There is a fee. They charge on an hourly basis generally for that. There's also something called a professional fiduciary. Here in California, there's actually a license to become a professional fiduciary, and you can find information about that through the Professional Fiduciary Association of California, whose website you see on screen there. These folks can act as a trustee. They can serve as the person's conservator, execute an estate, or help with kind of just day-to-day going through the bills, providing daily money management. They can serve as the agent under a power of attorney or be a medical or a healthcare advocate. These folks as well are paid on an hourly basis. Their rates are generally set by the court. So quickly, just want to kind of review with you some of the technology that's out there to support a long distance caregiver. And I have some examples of a few companies. These are just for reference, so some sites you can visit to have a look at some examples of these, but we're not necessarily endorsing these particular providers. We just want you to know that these types of technology are available. So automated check-in calls and reminder systems, personal emergency response systems, the buttons that allow a person to call for help, wearable activity trackers that can let you know how much or how little activity a person has had, and can also be used as sort of a form of GPS in the event that somebody wandered and got lost. There are some really neat free information portals out there. Caring Bridge is the sort of the largest, most widely used of them, where you can basically set up a secure portal where one person can designate, here's all the people that can have access to this information, and then you can post pictures, you can put updates about medical appointments, you can ask for help and support through this online portal. Communication tools, I'm going to talk about this in a little more detail here in a moment. But instead of asking a person with dementia to learn how to use a smartphone, for example, there are some simple telephone and video conferencing technologies out there that have been developed for older adults that are a little easier to use. Automated pill dispensers to make the management of medication a little simpler. Health and safety monitors and sensors. These can be used to detect falls, for example. Remote door locks and security systems. So you don't have to rely on the person to remember to lock all the doors. You can actually take care of it remotely. I mentioned GPS. Wandering response programs, please get in touch with us at Alzheimer San Diego. We can help connect you to lots of great GPS and wandering response technology that's available, and fall detectors. These are similar to the buttons that a person could wear that will detect whether if a person has fallen and not moved, and can call for help. Couple quick notes on video conferencing, which has really become the way of the world in the last couple of months. So even people that never used video conferencing before are finding themselves using this technology pretty often these days. I've listed for you here a couple of the most popular free apps that are out there. FaceTime, Google Hangouts, House Party, Jitsi, Skype, and then of course Zoom. We're all getting very familiar with Zoom. Video conferencing can be done through a variety of different tools. It can be done on a computer, through a tablet, via mobile phone, of course. But there's also a couple neat products out there. The Amazon Echo Show. It's like your smart speaker, that the Alexa that talks to us in our homes, but it also has a screen, so it can function similarly to a tablet and can be used to make video calls. And then if you haven't seen it already, there's a neat little gadget called the GrandPad, like an iPad, but it's created by a Consumer Cellular, and it's a senior-friendly tablet. So it too can be used for making video calls. Video calls, if you've got someone on the other end who can help the person with dementia set it up and facilitate it, can be really wonderful for people with dementia. It may be confusing, certainly, but for a lot of people with dementia, it's much easier for them to follow a conversation when there's visual stimulus as well. So as long as there's someone to help them with that technology, I certainly recommend giving video conferencing a try and see if it works for your person. Of course, you both have to have stable internet connections. It's just deeply frustrating when people are freezing or disappearing, minimizing the background noise and other kinds of distractions that might get in the way. Again, you want to make sure that they've got a helper on their end of some kind. You may even be able to help find a volunteer that can help with some of that technology. And as best you can, just employing as much empathy and patience for the person as you can, remembering this is probably new technology for them, and clearly if they've got cognitive impairment as well, this may be difficult for them to get the hang of. Okay, let's see. Okay, so a couple tips if you are making visits. Hopefully the days of being able to make face-to-face visits will return soon. Certainly don't just show up. Please coordinate with that primary caregiver. Ask them what they need from you. Are there some things I can take care of while I'm there? And this is a very important question a lot of people fail to ask. Is there anything I should know? Right? If the person's status has really changed, if there's a new behavior that you might find unsettling, try to get some of that information in advance. Again, this is going to help you with empathy for that care partner as well. If you are traveling frequently to another location, consider just keeping a set of clothes or supplies there. If that's possible, depending upon the situation, sort of makes the logistics of going back and forth a little easier on you. And think carefully about your visits, right? Be realistic, how long you're going to be there, how much can really be accomplished. Build in time every day for a little bit of a break for yourself, getting a little exercise or fresh air or time alone if you need it. And don't just jam pack your visits with all the tasks and the to-dos. Remember to spend some quality time together while you're there as well. So I'll talk just briefly in my final few minutes here about the resources and supports that are available, not just through our organization, but nationwide and in fact, globally. For long distance caregivers. So this is a quick look at the programs and supports that we offer through Alzheimer's San Diego. Many of them are offered remotely and virtually and are accessible to anyone, anywhere. You don't have to be in San Diego County to use our services. So visit our website or just give us a call, and our social workers are here to answer questions, connect you to any of those resources that you need. And difficulty with my clicking, sorry. There we go. Okay, a few other important support resources I want to make sure you're aware of. For those who are caregivers here in San Diego County, we have an amazing resource called the Southern Caregiver Resource Center. They are part of a California statewide set of caregiver resource centers that is known as the Family Caregiver Alliance. So if you're supporting a caregiver, or if you are a caregiver outside of San Diego County in California, you can find a similar resource in other counties, other regions. And then there is also a nationwide network called the Family Care Navigator. So you can search by specific states and find those specific government programs, legal resources, housing options, look for organizations like Alzheimer's San Diego, and much more in other areas of the country. Compassion and Choices is a wonderful online resource for gathering end-of-life planning documents, tools for having those important conversations, and similarly, it offers a state-by-state search function, so you can look up specific documents and tools that are relevant and legal in the state of the person that you care for. If you need to find a good estate planning or elder law attorney, anywhere in the country, you can locate one through NALA, the National Academy of Elder Law Attorneys, and the National Association of Senior Move Managers. These are professionals who help with packing, managing a move, making the transition, getting the new apartment set up, all of those sort of soup to nuts relocation services for older adults. You can find them through that organization. So I told you a little bit about us at Alzheimer's San Diego. We have two sister organizations elsewhere in Orange County and Los Angeles. Between our three organizations, we cover all of Southern California, so you can find resources for any of us through our individual websites. We are independent local organizations, but there is also a National Alzheimer's Association headquartered in Chicago with chapters all over the country. And then if you need Alzheimer's or dementia support information and support anywhere else in the world, ADI, the Alzheimer's Disease International, can help you find an association in another country. So I thank you for your time. We do have a few minutes left for questions. I'm going to invite Carrie to make any comments or facilitate what's next.
Thank you so much, Amy. I think we can all agree. I know I learned quite a few new tips and tricks throughout that presentation, so thank you so much for that. And we did have one question come through, and if anybody else has any questions that they'd like to ask, please raise your hand and type those questions in, and we'll be able to answer those. But Amy, do you have any suggestions on how we can offer a primary caregiver a break in this time of COVID-19?
Gosh, that is it's a really it's a very important question and a really hard one. So of course it would depend on the specifics of that particular situation. I'm going to just assume for the purposes of trying to answer this question that this is a primary caregiver who lives in the same home as a person with dementia and they need a break. So at the moment it's really tricky because of course we can't just send a neighbor over to come over and take the person for a walk or, watch a movie with them, for example. But I will say at Alzheimer's San Diego, we have a program called Alz Companions. This is a volunteer companion respite program where typically what we do is we send volunteers out into the home for 4 hours a week of a break for a care partner. And in the meantime, while we can't have them making home visits at the moment, they are doing what we're calling virtual visits, where with the use of some of those technologies that I was talking about, they set up a visit. They can screen share and watch a movie together, or go through photos, or they'll take the person on a little tour of their house around their backyard, or they'll watch some of these streaming webcams from the zoo together. So while it physically may not give a care partner a physical break and the ability to go away and get away for long periods of time right now, and at this point, where can we all go anyway? You can't go watch a movie or go get your nails done anyway. But it might help keep the person occupied for a little bit of time, so you can maybe go in the next room, take a little breather, read a novel, enjoy a cup of tea, right? At the very least, it kind of occupies the person for a short time. I'll say too, on our website, alzsd.org, we have a whole page devoted to COVID-19 specific resources. On our blog, we've been putting in all sorts of content ideas for social activities and engagement, ways you can sort of keep the person busy and occupied for a little bit of time. So it probably does come down to finding individual activities that you can engage the person in while you are helping the care partner have a little capacity. If you can set that up for them, then you can give them the capacity to kind of step away for a few minutes.
That sounds great. Thank you so much. We have another question that came in for all of you, just so that you're aware. We will be sharing the PowerPoint presentation with you afterward, as well as the recorded version of this webinar. So you'll be seeing that shortly. And then another question, Amy, could you explain a bit about the difference between power of attorney and conservatorship?
Sure. Power of attorney is something, so let's say right now, I could assign somebody to serve as agent for power of attorney for me. I would draft that document myself. So I could download a very simple form, or I could do this through an attorney, and I designate John Smith to serve as my power of attorney. So there's power of attorney for financial matters, and then there's power of attorney for healthcare matters. These could be the same person, or they could be two different people. So depending on how that document is drafted, either it goes into effect right away, or it's written in such a way that it goes into effect when I lose capacity. So I may say right now, I'm my own decision maker, but should the time come that I lack decision-making capacity, I hereby designate John Smith to be my power of attorney. So John Smith, as long as I created that form myself, I signed it, it was witnessed, it's a legal document, and he's got authority to do most of what might need to be done on my behalf down the road. A conservatorship is something different, whereas when somebody's acting as my agent for power of attorney, I still have quite a lot of my sort of fundamental civil rights. I can still vote, for example. I can make some decisions for myself. If I were to become conserved, this is something different. This is much more extreme. And a conservatorship might be necessary for a couple of reasons. I might not have created those documents. If I never created a durable power of attorney document, I never designated that agent, and then I lose capacity and I'm not able to make good, safe decisions for myself. I'm not able to care for myself. If there is no person that's been designated by me, a judge needs to make that decision. So that's where a conservator, a guardian, gets named. That's a person who is basically become my complete, they make all my decisions for me at that point, not just specific types of decisions. So that's sort of the extreme. No power of attorney document was created, and so we didn't have any other options. So a conservatorship had to be sought. So it is a legal proceeding. It's expensive, it's difficult, and certainly something we want to try to avoid. There are also a very few, but there are some limits to what a power of attorney can do. So I may have designated somebody to be my agent for power of attorney, but if the time comes that I need to be placed in a locked facility, either a mental health because of a mental health condition or because of dementia and cognitive needs that cannot be met in a traditional assisted living environment. If I am not willing to go, my power of attorney cannot just place me in a locked facility. This does require a conservatorship. There are some limits to what a person who's designated as your power of attorney can do.
Okay, thank you. Amy, we have a few more questions coming in. One is in terms of a family member who lives out of the area and who does not want help but will not let anybody into the home. And unfortunately, Adult Protective Services is suggesting that this person does need assistance in place immediately.
Yeah.
How do we handle that type of situation?
Gosh, that's really difficult. I mean, it's hard enough to be a long distance caregiver when the person is willing to accept your help, but much more difficult when they're not. I would say it depends, of course, on where the person is and what the regional entity is. But here in San Diego, Adult Protective Services, as you indicated, would be that agency. If they have already been out, they've been involved, and they have said somebody needs to step in, and the care partner is still refusing that assistance, I would say it's time for another call to that protective agency, if it's Adult Protective Services or whatever the agency is called in their particular county, making another referral, saying, you know, we've received guidance that more support is necessary. The care partner is not willing to accept that assistance, and that should get that ball rolling. You can also contact law enforcement to do something called a welfare check if you're concerned about the person's well-being. Depending upon where they are, they may have some type of an agency similar to what we have in San Diego County called PERT, the Psychiatric Emergency Response Team, who can be called out in a sort of emergency mental health related crisis. This can be used in the case of dementia as well. So it really, it depends on what programs and what resources and structures are available in their county. This is where contacting a local dementia services organization or contacting their area agency on aging can be very helpful. But keep at it. If Adult Protective Services is saying, yes, this is a protective issue, we need to get more support out there, you don't need to just give up because the person is rejecting that assistance. You can keep making additional referrals.
Thank you so much. There's a couple of questions that are pretty similar, especially in right now when we are dealing with the changes and the struggles with COVID-19. These two individuals have family members who have been recently placed into residential care facilities, and they're obviously not allowed to go and visit, so they're having phone conversations with their loved ones as best they can. Do you have any suggestions for how to have that communication? Are there simple ways to explain the pandemic? You know, should they continue with, I'll get there to see you as soon as I can, or any other suggestions that you might have for communicating with those loved ones?
Oh, it's so hard, and it's such a hard topic that, in fact, we're having a special event next week just to talk about this. As a matter of fact, next Friday, May 1st, we are going to be hosting a live Q&A with the dementia care expert Teepa Snow, who many of you may have heard of, who developed a method called the positive approach to care. To talk specifically about this, give us some tips for language we can use to connect with a person who doesn't understand, you know, what is going on here? What, you're usually visiting me, why aren't you coming to visit? Or, you know, why are all these people in masks all the time? Or, you know, just someone who's trying to understand exactly what is happening. So First, I'll just say that check our website. Information will be up and available about that shortly. And it's Friday, May 1st at 10 a.m. and it's free for all family caregivers. But in the meantime, I would say just start by letting the person express whatever they're feeling, right? If they're feeling unsettled, if they're feeling unsure what exactly is going on, you probably are not going to be able to explain the details of what's happening in a viral pandemic, or the ins and outs of no, I'm not able to come every week to visit like I used to. I'm waiting until the governor lifts the lifts the sheltering in place orders before I can come visit. And it's probably more detail than you're going to be able to help that person make sense of in that moment. I'd say the most important thing is to connect with them, let the person feel understood and heard, right? If somebody is saying, where are you? Why haven't you come to visit me? Instead of trying to explain away the details of what's going on, connect with them and say, I know I haven't been able to visit, right? There's this bug going around. We're trying to prevent other people from getting sick. And gosh, I really miss you too, right? Instead of trying to fix it or explain it away, we call that validating the person and just saying, I know this is really hard. I miss you as much as you miss me. I can't wait to see you again soon. Often just by letting the person know we see them, we hear them, that can go a long way to helping. We do have a short webinar that's available on our website on the topic of communication skills that you can watch anytime. It's free and available to anybody. So there might be some tips in there that would help as well.
Wonderful. Thank you so much. And it looks like we have other comments just thanking you for all of the information. It's been very helpful.
Great.
Couple of suggestions from family members to others would recommend possibly standing outside of the window with a telephone so you can actually see somebody, even if you're not able to go inside and visit with them in person or closer.
Yes, certainly. If you're physically close, if you're in the same town, by all means, contact the facility and talk with them about what some of those options might be. There's a window somewhere in that building, right? Maybe you can find a way. Mm-hmm.
The other suggestion or comment was in regards to Alexa, and for somebody it looks like who wasn't great with technology, it has been very helpful. So
Good.
for other family caregivers to consider that. And it looks like the last one is in regards to utilizing, it's another one with Adult Protective Services to help remove somebody that lives with their loved one from the home. Are there other resources to help remove this person quickly, especially since the live-in may have some concerns of their own, and it is more difficult now with COVID-19. And I will say you may have some resources, Amy, as well, but feel free to reach out to ElderHelp with this concern. We've had others that have expressed similar concerns recently and have been able to offer them some support, especially as it relates to right now. So
Great.
feel free to reach out to us too. But if Amy has anything else to suggest.
Yeah, unfortunately not. No, I'd say it's certainly reaching out to ElderHelp or an organization like it. And don't hesitate to lean on Adult Protective Services and law enforcement. There is great interest nationwide in learning how to be better supports to people that are living with dementia in the community. They're building those skills. They're getting more sensitive at working with our folks, and they would want to help. So don't hesitate. It doesn't always mean a big dramatic, encounter with law enforcement.
Very good. Well, thank you so much. It looks like that's it for the questions. Amy, I just want to say thank you again for being here and helping to share this important topic with family caregivers. Looks like from all over, somebody even joining us from Canada. So
Oh, great.
thank you so much for all of your time. And if anybody does have any follow-up questions, we'll be sharing Alzheimer's San Diego information in the follow-up, as well as ElderHelp. So feel free to reach out to either of us if you have anything that comes up after the fact. So thank you so much. And everybody take care. Have a great day.
Thank you for attending. Thank you, Carrie and ElderHelp, for hosting this.
Of course.